the reality is in the United States, you're probably not going to contract it at the moment. But, we have, I like the WHO just updated the numbers today, and there's 4,593 confirmed cases in the world, with 4,537 of them being in China. And, in the United States, we have 5 confirmed cases. And which I just think is, so if you think about the population of the United States compared to 5, that's a small number. And as of last night at 7 p.m., because the U.S. CDC, the Center for Disease Control and Prevention, they update the numbers at 7 o'clock every night. Basically, they had 5 positive cases. 32, so basically people under investigation, they had a total of 110, and there were 5 positives, 32 negative, and 73 people were pending. But of those 110 people under investigation, all of them had traveled to China. And when you look at it, it's, the problem was in China, this, it sounds like it came from the fish market, where we had a spillover event where the virus went from animals to humans. And in China, there's been a lot of person-to-person transmission, but there's been no confirmed person-to-person transmission in the United States, as of at least last night, if not this morning. So it's concerning, but we don't have any evidence that anybody in the United States who hasn't gone to China has gotten it, and people who've been exposed to those people haven't even gotten it here yet. Yeah, and if you look at it, there's I think the confirmed cases are in Oregon, California, Arizona, and Illinois. And so, the concern is it's potentially easily spread, and as we know from in China, there are fatalities. So it's not like we want to just blow it off and not be concerned, but I don't think that there's a need for mass hysteria, but there's a place because it's such a low risk at the moment. The number one way to prevent almost any transmission of an infection is washing your hands with soap and water, or an alcohol-based hand sanitizer. I'm not personally a big fan of the second one, but they do work. But when you look at the viruses, the coronaviruses, they're spread through respiratory droplets. So it's basically very much like influenza, the flu, and other colds. So someone needs to kind of cough or sneeze or wipe their nose or their eye, and then somehow get that liquid on you to be able to transmit it. So unfortunately, one of the hard parts is the best way to protect yourself is, if you're going to sneeze or cough, to do it into a napkin or a tissue, or to do it into the crook of your elbow, and then promptly wash your hands afterwards. So, but that's you helping other people. It's hard to get other people to do that. And you try to avoid close contact with people who are suffering from colds, fevers, coughs, and stuff like that as best you can. And if you're in an area, if you're exposed to them, then you wash your hands frequently and stuff like that. And you try to avoid touching their eyes, their nose, their mouth, or any secretions from those areas. And this is what you would just do, if your kid has the flu or a cold, you're less likely to want them, hugging and kissing you on the face and then I guess with this one in particular, we want to avoid travel, as much unnecessary travel, particularly to affected areas, and the the CDC and the WHO are recommending against unnecessary travel to China at the moment. But if you think about where you've seen this, we've seen a case in Oregon, case in California, Illinois, and Arizona, especially California and Illinois. I'm thinking of large airports and stuff. So that would be a place where maybe I would minimize going to those places until we know more. because the thing is, the concern is if this were to start spreading from person to person in the U.S., it could spread, relatively quickly. But I also know that the WHO has commented on the lack in the area in China where this is all happening. There is lack of access to really high quality medical care. So it's not like I want to roll the dice because I live in the U.S., but at the same time, I also understand that, the risk is relatively low at this point, and we just want to keep it that way. So what we think, the latency might be in this one. The biggest problem, I think, with the new coronavirus is it's like other ones, but not exactly. And so we're really not sure, what's going on. And it sounds like they think, the best we know is that the latency period is probably 2 to 3 days up to 14 days. But we're not, 100% sure at the moment. But again, so if it's, but like you said, like with influenza, I mean, you can, the biggest problem with influenza is you are transmitting it to other people and getting them infected before you actually show signs and symptoms of the disease, before you're sick. And this sounds like the incubation period might be on the lower end of that range I just described. But yeah, I mean, if you flew this morning and then tomorrow morning you're sick, the likelihood of it being this is probably low, especially if you didn't go to China. And it's funny, I'll just throw it out there just because I see people all the time traveling on the airplanes with the mask, like the procedure mask that we wear in the operating room and I have in the office when people are coughing. We're really trying to stop like huge loogies from coming out. I mean, it's like the typical type 1 mask can get 98% of things down to 1 micron in size, but like influenza is around 0.3 or so microns, and most coronaviruses are around 0.1 to 0.2 microns. So those masks aren't even getting it. And then we have those fancy N95, so they're basically saying nothing, 95, it'll block 95% of things down to 0.3 microns. But most of the coronaviruses, and actually I think influenza is more like 1 or 2 as well, because influenza doesn't really get typically stuck in the N95 masks, and they're not protecting it. So there's some other things it might prevent, but the biggest problem then, even if you have a mask that works, is it has to fit right. And then, and I found some research on a couple of masks. One of the some manufacturers of an N95 should work about 92% of the time for the coronavirus stuff, but others are estimated to work only about 50% of the time. So it's not like they're really going to help. I mean, certainly if somebody's hacking next to you, I mean, run away. But it's just interesting because we're doing all of these things because it seems like it would work, but they really don't. Or they have a low likelihood of helping. I mean, and if you're like in Connecticut, I mean, we have one person in quarantine in Middletown, which is, 20 minutes from where my office is. And that's a place where, but that person traveled to China and they're under quarantine now. So it's such a low risk at the moment. And I think people are afraid when what we should be doing is, promoting more facts. And I know the CDC is promoting the facts. I mean, their website's really clear on kind of what's going on at the moment, but social media doesn't help. And the other thing is, you just have to be aware. And I'm not saying like don't do the preventive measures, but most of the preventive measures are, doing all those things you mentioned. But like you would do for any other type of immune system optimization is get 8 or 9 hours of sleep a night if you're an adult. Minimize the amount of processed foods in your diet and decreasing sugars, if not eliminating all the non-natural sugars. Getting regular exercise. The best thing you can do to prevent yourself from getting influenza or any other kind of viral illness and potentially any coronavirus would be to have your immune system really humming. So do the immune supportive things that really can help. And then again, like, you know, if I have to travel, well, actually I have to travel to LA this weekend. I haven't even thought about putting a mask on. I mean, you know, it might be possible that, you know, buy a fancy N95 mask, or they have that Arianum or whatever the heck, urban air mask on that you can purchase. I mean, you could potentially, which is essentially an N95. This might potentially help you if you're running through the airport just to be super safe. But again, it's just like, if people aren't coughing, sneezing, or otherwise, you know, depositing their respiratory secretions on you, you should be fine. You know, and respiratory distress, those are more concerning symptoms. And so again, like if I'm on the plane with somebody like that, I would move quickly and flag a flight attendant. But outside of that, just, you know, give yourself some space, because they actually you have to come into contact with that. And those are like the main symptoms we know at the moment to look for. And I you know, hopefully we'll get some more information, especially out of China, the other things, but it just sounds like they get a really bad acute respiratory distress, and that's what ends up with life-threatening situation, you know, with an, you know, so, but again, like if people aren't coughing on you and people don't have fevers and respiratory distress around you, you know, the risk is very, very, very low. And at the moment, I mean, if you know, I haven't checked the latest count of how many people live in the United States, but it's gazillions, you know, compared to 5 people with it. You don't need to freak out about this stuff. I mean, I think you should be educated, and if people really want to know what's going on, you know, go over to the CDC website and keep up with the daily tallies. But I mean, 5 people. You know, and I grant it, maybe, you know, if you take the other 32 negatives out, or whatever it was, 35, and you look at those 73 who are pending, yeah, maybe like even if you call all 73 of them positive, you're at 78 people in the United States, all who have travel history. You know, and like the WHO is talking a lot about, you know, practicing food safety and what to do when you're shopping in a wet market and stuff. I think we don't have that stuff. And, you know, if we do, we haven't seen the spread there. So it's just common sense stuff, you know. And it's like, you know, they're talking about like handling, you know, raw meats properly, you know, and like if you're cutting raw meat, use a different cutting board and a different cutting utensil for, you know, your other food. I'm like, well, that's just how you're supposed to do it anyway. I mean, it's just all common sense stuff. The media just does its own thing, and I don't want people to not be aware and not be prepared if something were to kind of catch on wildfire. But if you think about it, you think about 4,500 and some people in China who are in an area where they have these open wet markets. They have nowhere near the sanitation that we have. They're not you know, they don't have the level of healthcare that we have an exposure to, and they probably, it sounds like, based on their living situation, probably don't have the access to, you know, kind of all the opportunities to eat a healthy diet and to do the exercise and the sleep that they actually need to stay super healthy to help prevent this. You know, so, I mean, could it spread here? Yeah, absolutely. But again, we have access to information and all these other things that they might not have as much access to. And so hopefully people will feel empowered, you know, by this, that, hey, I can go get the information, and then I can continue to practice all this really good hygiene and all these natural ways to support my immune system, and then you're in good shape.